here with Dr. Tom Biggs. He's one of the icons of plastic surgery, and would like to give us a few words about what to do in conferences.
Well, to quote Winston Churchill, never give up. Never give up, never give up. Just keep on hanging in there. Never give up. If you're giving a presentation, make contact with the attendees. Romance the attendees. You're in love with them and you want to tell them what you know, and you're happy to tell them what you know. That's the main thing. Know what you know and tell the others with joy, for the whole purpose of letting them go back and do the same thing to make our patients' lives better. Make our patients' lives better. That's our entire purpose of being.
Thank you, Tom. And let's watch his presentation on how to present during conferences.
I'm here with this group of world's experts, and that's what you all of you are, that to pass on our experiences so that other surgeons can make lives better. So if you're here to do better surgery, to teach better surgery, that's why you're here, and to make patients' lives better. I want to keep saying that over and over and over again, because that's exactly why we're all here. That's the basic reason we're here. Well, for me, my three is the one, the topic. I know the topic. I want you to know the topic. Two, I want to simplify it. And number three, I want to connect with you and show my passion for the topic. To inform you and to inspire you. To inform you and to inspire you. Inform and inspire. All teachers and all subjects need to be inspired. Informed and inspired. They showed their passion for the topic about which they were talking, and they transferred that passion to the people who were listening. And you want to be convincing, and you want to be and make your listeners inspired. Never boring. Never boring. Informed and inspired. Never boring. Don't be boring. Your audience is interested in what you have to say. Sell you the idea of speaking, giving a presentation convincingly. That's what I'm trying to sell you. Take home the idea. So when you leave here, think about this meeting. I hope you remember me talking to you about how to give a presentation so that you can sell the idea. First of all, you got to know your material. You can't stand up and talk about something that you don't know anything about. That's no good. You've got to know your material. And you have to know a whole lot more than you're going to even say, because you can't say as much as you know. If you can't explain it, you don't really understand it. If you really understand it, you can simplify it and explain it. You simplify it and explain it. You simplify and explain it. You feel your passion for the topic and you pass that on to your audience, information or feeling, and you use your body, you use your voice. You connect with the audience, you pass on your passion. You sell your idea. Passion, passion, passion. Connect, connect, connect. Memorization, do you stand up and give us something that you memorized? Well, maybe, but make it simple. Don't stand up there and quote a poem from memory. You want to stimulate, and you want to inspire. Simplify it, simplify it, simplify it. If they remember three things, you're lucky. Know your audience. Are you talking to your children's third grade class? Or are you talking to the National Archives? You need to know some names of people to whom you're speaking. If you have speaking to 5,000 people, you need to know 2 or 3 names. You know, passion, passion, passion. You got to show some passion. Know your room, okay? Know your room. Why am I saying that? Well, I'll tell you why. If the room is half full, you get people to move down. You want people to be closer. Have people move forward. Room, podium, this thing right here. I hate these things. Notice I don't stand behind that thing because I like to walk around and look at my people, look them in the eye that I'm talking to. I like to walk around, and I don't like to stand behind that podium. That podium is a barrier between the speaker and the audience. So don't ever stand behind the podium. Get away from that place. Sound, wireless mic. Here I am, wireless mic. I can walk around. Now, if these stairs are a little bit easier for me to climb, I'd climb up the stairs and talk to you or talk to you. I do that. And people are scared to death that I come talk to them. So you'll listen to me. You move around, move around. If you're using a handheld, look where the thing is. See where that handheld is? 1 inch from the mouth. It's not down here. And so many people who give too few lectures walk around like they're waving it like a wand. You got to hold it right there in front of your mouth. Room, projector. Always, always, always get your computer or your presentation married to that projector. On this screen right here, check it out before talking. Before you start talking. You want to romance the room. They actually fall in love with your audience. Well, I really do really believe that. I really want you to know what I think, and I really want you to know how I feel. I really do. And I want you to do that when you speak. Now, if you have a question, you step back. I wonder what we can do to solve that problem. And when you give the answer, step forward. For example, what is the best way to treat fibrous capsule contraction? The answer? Polyurethane. See? You step back if you have a question, and when you have the answer, step forward. That gives it more thrust. Eyes. You look at the audience. Look at the eyes of the audience. See? She has pretty eyes. Look at the eyes of the audience. Never, ever, ever, ever turn your back and look at the screen. Never turn your back on the audience. Never. Your voice, volume, speed, and emphasis. Example. Many new implants have fewer fibrous capital contractures, but none as good as polyurethane. Words. Quiet, loud. Slow, fast. Example. Quiet, loud is most people prefer shaped implants. Most people prefer shaped implants. Most people prefer shaped implants. Fast, slow. There are many colors, red, blue, green, yellow, and others, but all are in a rainbow. You see, when you want to make your emphasis, the first part of the sentence introduces you to the second part of the sentence, which is what you're really trying to get across. And what you're trying to get across, you want to speak more loudly and more slowly. Stay connected. PowerPoint. Oh, PowerPoint. Fantastic. It is a tool. Is it your friend? It could be your enemy if you don't do it right. You are central. You are central when you're talking, when you're speaking. You are central. You are the performer. Don't, and if not, just sit in on a narration. But you are the performer. You want to stay connected. You're a performer. You're a singer. These images are my background music. I'm the singer here. I want you to hear me. You can read those words up there. And that puts emphasis to what I'm saying. Now look at this. They spent a lot of money with some graphic designer who made that. It's terrible. It's worthless. It's worthless. Crystallix, more surgeries. That's what they're trying to say. How about that? This is worthless. Worthless, worthless. Too much stuff. Too much stuff. You lose your connection when you put too much stuff. Pre and post-op picture. Now this is a big one right here. I see people who show results, and they'll show case after 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 case. Oh, so what? What's the purpose? You don't want to show two, no more than three, but make sure each one of them is emphasizing some point you are making or have made. And if you want to show another result, that's another point you want to make. Each should make a specific point. Otherwise, boring. It's boring to see case after case after case after case after case. Boring. Now, perfect symmetry is a must. Perfect symmetry is a must. Lighting symmetry is a must. I've seen so many cases in the last 3 days where the lighting was not the same, where the symmetry of the image was not the same. Lighting is a must. Image size is a must. Look at this. This was in our newspaper. This was in the newspaper, talking about this actress Renee Zellweger. And the question was, has she had plastic surgery? Well, I took this picture from the paper. That's what they showed. Now, what can you learn from this picture? Not much, because the lighting is so different, and the hair is hanging down in such a fashion so as to block a lot. This is a worthless picture if you're trying to show some kind of change. Worthless. What does it prove? Not much. But look at this. That is the way I want. That's almost the way you want to do it. But I'm critical of this picture. It proves good results, and it's good. The lighting is good. The symmetry is good. Everything except one thing. you'll notice, and I draw a line, I draw a mental line from the columella to the lobule of the ear. You'll notice that from the columella to her ear is a little bit above the columella. So she's looking up just slightly. Just slightly. So I'm critical of this picture. Even though it shows a good result, I'm critical of this picture because it's not exactly perfect. We're going to control the hair and the jewelry. Minimal makeup, same pre and post. No smiling. You know, I think you can get the greatest facelift in the world if you get the pre off this way and the post out this way. Wow, the middle third goes up beautifully. Now a little drama is okay. Here's a little drama. Ah, that's good. That's good. I like that. But this is a little too much. That's a little too much. That's too much drama. Too much. Now, word slides. Word slides. You can't read and listen at the same time. If you're reading, you're not hearing what I'm saying. If you're hearing what I'm saying, you're not reading. You can't read and listen at the same time. Font size. Well, as large as reasonable. Too much is shown with the font so small that if you're sitting where you in the beautiful pink sweater are sitting, you can't read what's on the screen because the font is not big enough. They give you a screen that big. Use that screen. Use it. Make your font size as large as reasonable. No more than 10 words on an image, because if you've got more than 10 words, you're spending all your time reading the screen. That's no good. Fewer the better. Now, you notice I use custom animation a lot. I'll bring in the second part of that image with the custom animation. Conclusion, subfascial placement. Now this one is done by a dear friend of mine from Brazil. The fascia blunts the implant edge, provides an goes on and on and on. The better way is, the conclusion is, that a subfascial implant placement, fascia blunts the implant edge, and it provides a natural looking breast, and there's no distortion with muscular contraction, and it's good for thin and athletic patients. That's the way to do it, with custom animation. Bring in each thought as you're saying it. How about this one? Woo! That'll get you, won't it? Well, candidates. They have minimal skin laxity, minimal time, they desire more malar fullness, they have minimal money, they're a smoker, post-op surgery, and male. These are for threads. Patient's good for threads. So, try to coordinate your written and spoken words. Make sure that what they're reading is what you're saying. So simple. Custom animation will do that for you. Now, how about this one? You saw this one yesterday. That's a baseline MRI of the patient of Rogers. And 3 weeks post-Bravo, she looked like this. Perfect for our graft. When describing a new technique, show it. You're going to describe a new technique. Example, the incision for axillary augmentation is 1 centimeter lateral to the lateral edge of the pectoralis major. Words. Better way is to show it. Show it. This is where you want to put the axillary incision. Only, I kind of disagree, I'd put it a little higher. But this is done by a person with a lot of experience with that. So that's rather than words, show it. When you name a contributor, show a picture. Fat grafting is good in recalcitrant wounds. Look at this, nipple sparing, implant, immediate operating room radiotherapy. If you're going to quote somebody, show their picture. You can find their picture in Wikipedia or YouTube or somewhere. Show their picture. And a new implant, 2 gels, and shape and projection of the lower pole. A lot of words. This guy right here, the Diagon implant. You can just say that. Lower projection in the bottom quarter. You see, and 2 different gels. There it is. That's the Diagon implant. And this is the guy that designed it. This is what you want to show the people that you're talking to. They want to see the implant, and when you talk about some person, you want to show their picture. There he is. When you're talking to your audience, don't read. Don't read something to your audience. If you want to put them to sleep, you do it. Don't read. Think about Gutenberg, 1439. 500 years brothers have been doing that. Stay connected. You can't read and listen. You're passionate about your work. Show it. Show it, show it. So, how to give a presentation? Know your material, know your audience, know your room, and get and stay connected. Get and stay connected. Simplify it. And show your passion. Don't be boring. Fast, slow, soft, loud, sell your idea. Will always be the mother of learning. How to give a presentation, my 3. Know your topic, simplify, and stay and connect. Well, now 4th. inform and inspire. I hope I've inspired you to give better presentations. So, thanks.